PANDAS, a lot of people have heard about with basically you get in strep infection. So it's pediatric acute onset neuropsychiatric syndrome associated with streptococcal infection. So they get a strep infection. That strep infection cross-reacts with their dopamine receptors, and then we start having things like OCD, anxiety, tics, basically things that from our basal ganglia, but these things happen really quickly, kind of overnight.
Of course.
And they start getting all these symptoms kind of out of nowhere. And then PANS is pediatric autoimmune neuropsychiatric syndrome, where that can be triggered from lots of other environmental things, other infections, viral infections, mold, heavy metals, environmental toxicities. They can trigger an autoimmune issue against these same receptors. And again, you will get, usually pretty quickly, you'll get a change overnight they'll start developing tics, OCD, anxiety. And like this actually happened in my own son after a mold toxicity. And that's kind of why I became so passionate about it, is because I've been able to see his transition from, really severe tics, really severe behaviors to over a couple year period to being back to completely normal. And, it was a big journey and I learned a lot through it. And so that's a big reason why I want to talk a lot more about it for sure. And also nearly every kid I've ever seen with autism, I'm not every single one of them, but a huge percentage of them, a lot of kids with ADHD, a lot of kids with learning disabilities, they have some form of autoimmune issue going on when you actually start to run the test and dig a lot deeper.
Well, absolutely. And I think like you're hitting the point on the head about like the immunological cascade when it comes down to like these kids, and there's always something underlying that's causing their immune system to be exacerbated. But you mentioned a few points that I thought were kind of intriguing, and you were talking about D1 and D2 receptors and that specific immunological cascade which affects the brain, causing that brain inflammation. Tell some of the viewers a little bit about what the side effects of damage to these receptors, like symptom-wise, would look like in their kids.
When one of them gets affected, basically we can't calm down the brain. So we're stuck in like a go, 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 and we have no brake pedal, right? And so that's going to look like OCD. It's going to look like anxiety. It's going to look like repetitive activities. Think of their brains going too fast or systems are going too fast. And then the other system, the other dopamine receptor, when it gets dysregulated, it's going to look really slow. So it might be really slow cognitive processing. It might be just overall just decreased function, slowness of movement, slowness of thought, attentional issues. So they can have different effects, whether it's a D1 receptor or a D2 receptor, but a lot of times, especially in this type of case, when we're seeing OCD, anxiety, tics, we're seeing more dopamine 2 receptor antibodies, and we're seeing more like antitubulin and
anti-myelin.
Anti-myelin in those types of cases. Maybe some Purkinje cell issues. But yeah, traditionally when you're talking about PANDAS, you're looking more at dopamine 1, dopamine 2,